Hi, I'm Dr. Pierce.
I'm Dr. Kabir.
Okay, hi, nice to meet you. Um,
It's nice to meet you too. Our patient is Fatima Aliu Isa, and she is 3 years old. You can see this is her brother that brought her to the hospital today.
okay.
So she
I'm
came with some complaints, and this is why we are here with her today.
okay. Can you thank them for being here?
Okay, wait, I gode. She want to thank you for being here.
Thank you.
She said they also say thank you.
Okay. Does she have a fever?
Okay, you want to know whether she has fever? She
Yes.
actually has fever and
Okay,
cough.
can you describe the fever? Like, does it come and go or is it continuous?
The fever is continuous.
Okay. When she coughs, does anything come out?
The cough is dry, nothing comes out.
Okay. Um, I see she's laying down. Does she feel weak?
She feels weak.
Okay. Is there any shortness of breath?
Yes, actually, she had shortness of breath. Initially, she had shortness of breath at the beginning of illness, but that has reduced.
Okay. Are there any spots on her skin, like rose spots?
No,
Like
there is no
bumps?
any spot. Can you see her leg?
Yes. Um,
There is no any spot, no spots on the body.
is her fever, what's her fever like? Like, is it does it rise and then come down but not back to normal?
No, the fever has been on throughout the illness.
Can we run a hemoglobin test and a blood culture?
Yes, full blood count was done for her, and hemoglobin was 11 grams per deciliter.
Okay.
The the white blood cell count was 15,000 cells per liter. The
Okay.
platelet count was adequate. The culture revealed Staphylococcus aureus.
To treat it, we do a antibiotic, amoxicillin. Or does she have any allergies to medications?
Not really. She has taken drugs before. She has taken drugs, antibiotics before there was no any allergy.
For the ARI, can she take an antibiotic?
Okay. You should give her antibiotics. All right. That's great. Actually, that is a diagnosis we have about this patient.
Okay.
And you did very well by making that diagnosis. So you tried to exclude other cause of fever, trying to find out whether the fever has a step ladder pattern or the fever that is seen more commonly with typhoid fever. Either the fever comes and go, meaning that an intermittent fever that is more commonly seen more commonly with malaria. So that is good. And we went further to find out whether investigations have been done. I told you result of full blood count and blood culture,
Yes.
which will make a diagnosis of respiratory tract infection, and proceeded to treat the patient with antibiotics. That's great, Dr. Fees. You really did very well. Um, you make the correct diagnosis, and you have prescribed the right drugs for her, IV antibiotics. So now will you offer some advices on prevention so that Fatima will not come back with the same infection?
I'd recommend maybe washing hands, um,
Okay,
good hygiene,
okay,
possibly a vaccine.
okay. That's great. Dr. Fees, because hand washing alone can really help in preventing the infection,
Yes.
so that you don't carry it from one person to another. And then you talk about immunization, vaccination. That is important because some of those infections can be prevented by immunization. And good hygiene, like you said. That's great, Dr. Peace. We really thank you very much today.
Thank you.